Hello, my name is Joe Corby. I want to welcome everyone to the 2021 Glenn Kilpatrick Memorial Address. Today, AFTA will dedicate one of its principal speeches to a topic that is very important to this organization. That's mutual reliance. With this presentation, we honor Glenn Kilpatrick, who I know would be very pleased with the current state of FDA and state relations that currently exist. Let me begin with just a bit about Glenn Kilpatrick. Glenn began his career with the state of Utah, working in food and drug safety. He then went to FDA in 1960 and 10 years later became the director of the Division of Federal State Relations. He was always a very strong advocate and believer in FDA state collaboration. And he actually spearheaded the system we know as NERSTN, which is the National Regional State Telecommunications Exchange Network, which was a way to communicate with the states. He orchestrated the annual FDA and AFTO meeting, which is probably the most important meeting the AFTO board has every year. And Glenn also pushed for the commissioning of state officials and for FDA state contracts. I can only imagine a great pleasure Glenn would have in seeing the efforts so many people have made for advancing an integrated food safety system. And it is mutual reliance that is the mechanism in place right now, that will bring us to a point that we envisioned 23 years ago. Presentation today will be somewhat of an open discussion with three key individuals. Eric Mettler, who is the FDA Assistant Commissioner for Partnerships and Policy. Vanetta Howard-King, she is the Director of FDA's East Office of Human and Animal Food Operations. And Natalie Adan, who is the Division Director for Georgia Department of Agriculture's Food Safety Division. Let's begin the discussion with Eric.
Thank you, Joe. It's really my pleasure to be here with you today, and I'm truly honored to have been asked to take part of the Glenn Kilpatrick Address this year. It is truly unique in so many ways. First, it's virtual, which I'm still trying to get over that, but hopefully next year we will not be virtual. But really, it's the first time that I believe we really are showing the true partnership in one of these addresses. From the past, from what I remember, it's always been one person out there talking. And this time, it's actually multiple. And so I think this is sort of what Mr. Kilpatrick actually wanted, was a true partnership and actually having us all here together, really talking, showing what we've done and how we're working together. So I really, it's just a truly honor to be part of this. I personally didn't know Mr. Kilpatrick, but everything I have read about him, everything revolved around partnerships. Whether it was his time in Utah or at FDA, it was the cornerstone of what happened. And reflecting on it, Joe, I believe you said this, and I know others have said this as well, but I think Glenn Kilpatrick was really responsible for laying the early foundation for the integrated food safety system. He truly started everything and really got it moving forward. As we all know, the integrated food safety system really provides the vision for and guiding principles for key components of a coordinated approach to food safety. An integrated food safety system also describes the continual improvements in collaboration and activities that can be addressed through a collective of programs and projects. And as you stated, one of the key things in this piece is really domestic mutual reliance. And that's one of the foundational pieces that will get us to achieve the integrated food safety system. As many of you know, the domestic mutual reliance is a seamless partnership that enables FDA, states, and states with each other with comparable regulatory public health systems to treat each other as trusted partners, to fully rely on and coordinate with and leverage each other's work and data and achieve public health goals for a safer food supply. And once achieved, really, the domestic mutual reliance will allow for more efficient and effective use of resources and collaboration and risk and for informed decision-making about activities that either partner may carry out. We've really truly come over a long way in the past decade. And a lot of these activities are going to actually hear from Natalie and Vanetta about this, where domestic mutual reliance is actually happening on the ground level. Joe, I think you and I could talk about domestic mutual reliance all day long, but where it actually happens is on the ground. That's where it happens. That's where it matters. And that's how we're going to get to the integrated food safety system. So I'm really excited to hear from Natalie and Vanetta, basically everything that is happening in that space. But before I really want to turn over to them, I sort of want to talk a little bit about where FDA is going to be focused over the coming years and really sort of achieving our journey to fully extend it out to domestic mutual reliance and achieve the integrated food safety system. The first area is really trying to establish individual pathways with each state to formalize our domestic mutual reliance commitments. And, as I said, individual pathways, because, as everyone knows, once you've, worked with a state, it's a state, and we can't treat every single state the same. And these pathways that we establish really need to outlive the people that are actually putting them in place. We don't want it to disappear once someone leaves their position, retires, or wins the lottery or something like that. We really want to have a baseline of success in there and a roadmap to achieve the domestic mutual reliance that we're really striving for. A lot of these activities, again, you will hear Vanetta and Natalie talk about them. But one of these examples that I think is really fitting for this address that we just put in place was a partnership agreement that we recently signed with the Utah Department of Agriculture and Food Division of Regulatory Services. This really started establishing a pathway in areas that we're going to work together with the state of Utah to achieve domestic mutual reliance through work planning, training with each other, and sharing information with each other. And I must say, Joe, and to everyone else, during the signing ceremony, you could really feel the culture that Mr. Kilpatrick established, both in Utah and FDA. That partnership culture was there. So it was truly special to do that recently. The second area that we really want to focus on, and I think everyone needs this, is information sharing. Everyone is very aware of our commissioning process and 2088 process. While it has been working, there have been times where we need to sort of expedite that or try to find new ways to share information. Information sharing is key, especially during public health emergencies. Sharing information in real time is sort of what we need to be doing all the time. And so the FDA is committed to continue to try to find new and innovative ways to do this over the coming years. And one thing that I've spoken about a lot across the board, and I'm going to continue to do this, and FDA is going to focus really hard on this, is looking at the food safety workforce. And that is all of us together. It's not just FDA, it's not just the states, it's not local, and it even includes industry. We really need to be taking a hard look at the entire food safety workforce and food safety in general workers, and look at the diversity, equity, and inclusion to really sort of prepare our workforce for the future. We really need to make sure that they are ready for what's coming down the line. Industry is being extremely innovative in what's going on and what's happening. During COVID-19, the industry adapted fairly well. And I must say, the states and FDA and locals adapted just along with them. And we need to keep that pace. We can't wait for a public health emergency to spawn innovation. So we need to keep this pace up. We also really need to look out and look at sort of the future of what are people entering into the food safety workforce. We need to go out there and find them and create a career path for folks that they really understand what they're getting into. They understand that it's actually an option for them to get into this career path. And then when they get in, try to help work with universities and things of this nature to really make sure that they come into either FDA, the states, or elsewhere with the background that they need so they can hit the ground running. In addition to this, I really want to make it clear that we should not be focused purely on the regulatory aspect of food safety workers. We need to focus also on those that are working in industry. If they understand the fundamentals of food safety and food safety culture, it will change the game. It will truly change the integrated public health system and integrated food safety system. It will be a fundamental shift, I believe, across the board that is just absolutely essential. So with that, I really want to turn it over to Vanetta and Natalie, but I really want to thank everyone that is listening to this and on the line and watching for all your steadfast dedication, not only during the public health crisis of COVID-19, but even before and after. But truly, truly thank you for keeping my family and every family in the United States safe. So thank you. Vanetta?
Hello, and good morning, everyone. Thank you, Joe, and thank you, Eric. I think it's pretty clear that Glenn Kilpatrick visualized the concept of federal-state domestic mutual reliance long before we defined it. And the words that resonate the most with me in that definition of domestic mutual reliance is trusted partners, because it's what we have to be if domestic mutual reliance is going to be successful for all parties involved. Now we know the concept of domestic mutual reliance isn't new. FDA and states have been successfully partnering in many different ways for many years. And so we also shouldn't expect, as Eric said, we shouldn't expect it to look the same for every state and for every FDA division, because domestic mutual reliance really is based on the needs of the trusted partners involved. So, and as trusted partners, you think about, can we do better? Yes. Are we going to do better? And should we do more? Absolutely. And Eric talked about some of the things that we've done, where we're going. And Natalie is going to pick up on some of that too and talk to you about that on the state, from the state perspective. But I want to recognize some of the collaborative activities that FDA, field staff, and state partners have been engaged in for several years. Work planning sessions, sharing compliance activities, joint inspections and investigations, especially during outbreak response, sharing of lab results, and even on-the-job training for state inspectors. So domestic mutual reliance has been around for a long time. We also have some examples of some recent activities between divisions and states regarding domestic mutual reliance. And a great example would be what's happening in between Half East 4 Division and the state of Florida Department of Agriculture and Consumer Services. The Department of Florida has been sharing data with FDA, and FDA has been sharing inspection data with Florida. So at this time, Florida has been able to use over 550 FDA inspections, and our Half East 4 Division has been able to use over 430 non-contract state inspections. This actually has maximized coverage and resources for both agencies. And as I just mentioned, this isn't a one-way process. FDA and Florida are sharing inspection data to help meet both federal and state inspection frequencies. This is mutual reliance between domestic mutual reliance between trusted partners. Another example Eric mentioned in his presentation was what took place in April of this year with our Half West Division 4 and the Utah Department of Agriculture and Food Division of Regulatory Services. They signed the first domestic mutual reliance partnership agreement. This agreement establishes key areas in which the division and the state of Utah would like to collaborate on. Areas such as Eric mentioned, data and information sharing, official establishment inventory maintenance and inventory reconciliation, work planning and risk prioritization, training of field staff, and exploring ways to support collaborative inspection, compliance, enforcement, and corrective actions. For example, non-contract, non-high-risk inspection sharing. Now, when I think about the future of domestic mutual reliance, I think about the New Era Smarter Food Safety Blueprint, specifically Core Element 2, which is smarter tools and approaches for prevention and outbreak response. FDA is going to be working with our trusted partners to further expand our federal state rapid response teams and their functionality. Also under Core Element 2 of the New Era Blueprint, FDA is looking at ways to work with our partners to modernize food safety inspection processes. So as you know, FDA met with, AFDO met with FDA last summer with a proposal for a remote records review process as a new inspectional tool due to the COVID pandemic. FDA then developed a cross-programmatic remote regulatory assessment process, or RRA, and we engaged in a feasibility study with FDA-registered food firms that were actively engaged in a compliance dialogue already with the agency. The feasibility study was a success. And now FDA and our trusted state partners will be able to use this new tool post-COVID. And we'll be able to use it in a way where both agencies can verify corrective actions and review manufacturing documents ahead of conducting an inspection at the facility. So the RRA is going to help promote a more focused on-site inspection and limit the time that both FDA and state regulators spend in a facility. So I also don't want to leave out IT. Another example of future domestic mutual reliance activities involves enhancing the capability and capacity of our IT infrastructure. It will promote a more integrated approach to work planning and risk prioritization. Are there some challenges? Absolutely. The cost for and maintenance for enhancing IT is a little bit of a concern, but it's not an impossibility. We have to improve the IT infrastructure on both federal and state levels. And we can do this by working together. Nothing that I've said is an impossibility. And I look forward to working with our trusted partners moving forward. Thank you.
Thank you, Vanetta and Eric and Joe. Thank you for having me on such a distinguished panel and in honor of Glenn Kilpatrick, who had a vision that we're still carrying forward today. I want to talk about mutual reliance and what it has done for the states. Mutual reliance is not a one-way transaction. FDA has provided the funding and the conduit in many ways to build towards mutual reliance, but the partnerships and successes will go well beyond the realm. A great example of this, and Vanetta brought up the rapid response team, the RRTs. These have been a huge success. We've shown by using this model that we can minimize the time between notification of an event and the implementation of effective control measures. This is huge, but let's admit it, it's not because FDA and the states alone. The RRTs have developed and strengthened partnerships and communications far beyond the FDA and the state or local that houses the RRT. This has pushed us to connect with other local, state, and federal agencies and begin identifying ways we can work more closely together. States have historically been good at communicating among themselves, but we've also opened the door for sharing experiences, best practices, awareness of current challenges, and overall better understanding of developing a system that truly relies on others in an effective manner. Through FDA support, we've had the opportunity to further mutual reliance between states, such as mentorship programs, the development and implementation of new programs such as produce safety, or just reaching out to compare current challenges. Another great example is the Food Safety Task Force. Through FDA funding, we've been able to put this concept together to strengthen partnerships with industry, regulatory, academia, as well as consumers. This is what working as a team really looks like. The recent COVID crisis also allowed us to see how important partnerships and communicating information was coming to us from all directions. It was changing often, and we were looking for answers, and many were having a reduction of resources as well. I'm also thankful for the many associations such as AFCO for building tools and providing platforms to make these connections easier. So we've come so far, but we need to continue to identify areas where we can improve and advance. We're just maintaining status quo if we don't continue to evaluate and brainstorm together on ways to improve and do more. Eric brought up information sharing, and this is one of these areas. We've been able to share information, but we need to do that without impeding on the timeliness of our response, or in some cases, preventing a response. We need to continue to drive efficiency and standard practice, which is what Vanetta just spoke about. This is using a work smarter, not harder approach, using technology to drive us forward and not allowing old procedures or protocols to hold us back. This ties in well with FDA's new era of smarter food safety, as well as the Partnership for Food Protection initiatives. We do not need to duplicate our efforts, but instead use each other's information to drive us further. We need to participate in funding opportunities that drive partnerships with Mutual Reliance Initiative. We're building something together with the expectation to maintain and grow from this development. Building something without forethought or planning of how to maintain to grow is not a good use of resources. We need to work together with a future vision to be successful in protecting public health. I say all this to make a point of how much larger Mutual Reliance and the development of an integrated food safety system really is. I sometimes joke with my team that we're about to take over the world, but all kidding aside, we're building on to something that truly can make a significant impact in all that we're able to accomplish. So thank you. Joe?
What a great discussion. Many thanks to Eric and Vanetta and Natalie for this important discussion on Mutual Reliance. Like Natalie and Eric and Vanetta, when I think of all the barriers we all needed to overcome in the past couple decades to establish integrated food safety system, it's really very gratifying to see where we are today and the promise that Mutual Reliance really provides. We do have some more challenges ahead, but I really believe we're in a position now to firmly establish that integrated food safety system. I also believe that it's time for the states to step up and really look and consider how they can best participate in Mutual Reliance. As Eric said, it's not one size fits all. Every state will be different. Well, so over 2 decades, we've worked to reach this, what I believe is a historical point. And you're going to hear a lot more about this during the AFTO conference this year. So I want to thank you for listening. I hope you enjoy AFTO's 125th birthday and AFTO's 125th annual conference. Thank you.